Hey, what's going on, guys? It's Dr. Jeff Staley with Kinetic Evolution. And today we're going to give you a few things that you can work on to help improve your breathing mechanics. Proper breathing, or using the muscles that we're designed to do most of the heavy lifting with our breathing, can help with a variety of things. It can help improve our posture, help improve our core stability, help reduce some of that upper back and neck tension we get from sitting hunched over all day. It can help oxygenate the blood as the lungs are more vascularized down in the lower part. So making sure we're getting that air deep down into the lungs, again, can help oxygenate the blood. So what we mean by proper breathing mechanics is most of us, or when people sit all day, we sort of sit in this slouched over position where, on our phones at the desk all day. And we have this muscle called our diaphragm that essentially separates the chest from the abdomen. And it's one of the main muscles that's designed to do a lot of the leg work with our breathing. So when we're sitting in this slouched over position, the diaphragm really doesn't have anywhere to go and it can't do what it needs to do. So we resort to using our upper back and shoulder muscles to sort of pull the rib cage up, and then we get these kind of shallow shoulder breaths that again are creating sort of a nightmare with our posture and a lot of that upper back and neck tension. So, for starters, we want to make sure that we can actually move and we can get in those upright positions so the diaphragm can do what it needs to do. So to start with, we're going to get out of that sort of slouched over position that we spend most of our workday in. We're going to get on the foam roller. And a mistake a lot of people make when they're on the roller is we just sort of flop over top and we let the ribs flare up, and we're really not actually mobilizing the spine. We're just kind of flopping over the foam roller there. So first thing you want to do is a little bit of an ab contraction. That's going to hold the ribs down. From there, as we lean back over top while keeping those ribs down, I'm actually getting some extension in the spine. So, which is the goal of this. So what you want to do, you're going to keep that engaged, and as we roll up and down, you're just basically looking for areas of tension, any of those nasty spots in there. From there, you can lift the bum off the ground a little bit to put a little more pressure down, and just keep rolling and making sure you're getting that good extension through there. It shouldn't be any sharp pain. It's not always the most comfortable thing, but if you're getting sharp pain, just avoid those segments and kind of work above and below that. And again, you're picturing these are the vertebrae in the back, and we've been stuck in this sort of flexed position all day. What we're doing is getting over top of that foam roller and mobilizing it in that opposite direction. So 2-3 minutes on top of there, most days of the week if possible, especially if you're spending a lot of your time sitting. So now we're getting out of that flex position, we've got some extension. Now we want to get a little bit of active mobilization into rotation. So one that I like to do is I get on the hands and knees. I'll sit back on the feet a little bit to target a little bit more of that thoracic spine, which we're trying to mobilize for this specific drill. And I'll just put a hand on the back of the head. The arm's not really doing much movement, it's more or less guiding the movement. So if I've got my left hand behind my head, what I'm doing is I'm trying to rotate down and bring my elbow between my right knee and my right hand. And then from there, again, initiating all the movement through the torso, I'm trying to point that elbow towards the ceiling. So just getting some nice, controlled, active rotation, really exploring those end ranges. And just go until you feel you get some of the tension out of there. 20-30 times aside, and then you're just going to switch and essentially do the same thing on the other side. So again, after we've kind of loosened things up with the foam roller, we're getting in there and doing some active mobilization. So now that things can move, we want to do a bit of a breathing specific exercise. And this one's more about just thinking about what you're doing, paying attention to it, and actually seeing if you can, engage the proper muscles. So nice easy one to do is you get on your back, knees are bent, that's going to take some pressure off the low back. Just have a hand on your sternum, hand on the belly. Essentially what you're doing is just taking some nice deep breaths in through the nose, and you want to feel the abdomen expand a little bit. So the hand on the chest really shouldn't be moving much. You don't want to feel those shoulders elevate, they should stay down and nice and still. There shouldn't be too much expansion through the chest cavity. It's more about the abdomen expanding from the top and the side. So what it looks like is you get in this relaxed position. I like to close my eyes so I can really kind of picture what's going on. And I'll start with just deep breaths in through the nose. So So you get the idea. I need a little work on that myself right now, but spending a couple minutes, first thing in the morning, last thing at night, just paying attention to that can make a huge difference. For your performance, making sure that diaphragm's doing its job, it plays an important role in core stability. And then for sort of relaxation times, it's sort of meditative, really paying attention to your breathing and taking those deep breaths in through the nose, a little bit longer exhale through the mouth. That's going to activate the parasympathetic nervous system, which is really important for the rest, recovery, relaxation, that sort of thing. So give those exercises a shot, see how that works for you. You know, definitely buy into it for a week or so so you can really sort of, you know, get an idea of what's going on there and notice a difference. But give them a shot. If you have any questions or concerns, leave a comment in the section below. Love to hear from you. In the meantime, if you like this video, subscribe to our channel and check out some more of our videos.